Good morning, Vanakkam. I am Dr.S.Jayaraman. I am a consultant pulmonologist. I am a secretary of IMA AMS TNSB. Today is the World COPD Day. COPD you all know very well, second leading cause of mortality in the world. COPD, chronic obstructive pulmonary disease. This is a very common disease. This year theme for World COPD Day is short of breath, think COPD. Any breathing issue, persistent, chronic, we have to think in terms of chronic lung disease, mainly COPD. There are various causes of COPD. There are two main causes. 70% cause of COPD is air pollution, indoor air pollution, outdoor air pollution. 25 to 30% cause is the tobacco smoking. So, this is a preventable, treatable, manageable and curable disease. Air pollution we have to avoid, tobacco smoking we have to avoid. This is the main prime, so preventive aspect. So, wherever you go out, wear the mask, cover the nose and mouth to prevent inhalation of polluted air into the lungs, which causes chronic lung disease, mainly COPD, chronic obstructive pulmonary disease. The common symptomatology of COPD, cough, maybe dry cough or wet cough sometimes, breathing issue and chest tightness. There are a lot of asymptomatic, there is a non-specific symptoms. How to confirm whether patient has COPD or not? The gold standard test to confirm COPD is the spirometry, simple spirometry, that is a pulmonary function test. Nowadays we have a oscillometry also to find out the airflow limitation. All the whether restrictive or obstructive disease we can find out by doing the simple test called spirometry and advanced test called oscillometry. So spirometry is a test, it's a confirm reversibility. COPD is a partly reversible or it's an irreversible disease. It's a slowly progressive disease. So if we have plenty of effective treatment modalities. Inhaled medications. So inhalers are the cornerstone medications for the COPD. And prevention of exacerbations, we have vaccinations, annual flu injection before monsoon and one dose of pneumococcal pneumonia vaccinations. These two important. Apart from these two vaccines, apart from these two, flu and pneumococcal, so we have a pertussis vaccine, shingles vaccine, etc. So these vaccines prevent exacerbation of COPD. COPD exacerbation we call it as lung attack. This is the second leading cause of death next to heart attack. Such a common disease. So we have to give awareness to the general public and our own colleagues about the COPD. This is a huge burden in our country, in the world, in the global scenario. This is a very common disease. So treatment is inhaled medications are cornerstone. Pulmonary rehabilitation are very important treatment modalities. Supportive treatment. So we have a awareness of allergens, awareness of tobacco smoking, to lung transplantations. We have treatment options available for chronic obstructive pulmonary disease. So today is the World COPD Day. Short of breath, think COPD is the theme. Kindly spread this message to everyone. Avoid tobacco smoking, avoid air pollution. Wearing the mask is a very important preventive aspect. Wherever you go out to the polluted area, wear the mask, at least do some handkerchief, cover the nose and mouth. This will prevent certain extent to prevent worsening of the disease. So this way we can prevent and we can treat the diseases. If you stop tobacco smoking and the air pollution inhalations, minimize the air pollution, so we minimize this problem. So indoor air pollution, we can keep some air purifier or a good ventilated kitchen. We can use the chimney for the sucking of air. So fumes through this pipeline to the outside, and lot of preventive practices we have to follow to prevent COPD, chronic obstructive pulmonary disease. There are several classifications. This COPD comes under the obstructive airway disease, OAD. In the COPD there are several classifications including asthma. Asthma also one of the chronic lung disease. COPD-A, allergic asthma. COPD-E is environmental, mainly the smoke, industrial exhaust and the petrol diesel vehicle exhaust, road dust, etc. And we have the epistematus, so congenital. COPD-C is a congenital. COPD-C, cigarette smoking, tobacco smoking, and a lot of the COPD classification, phenotypic classifications. So based on the phenotype, we have to address correctly. In the indoor biofuel gas inhalation, this we common association with the female populations, and in the wood stove and other stove, which leads to chronic inhalation of fumes, which leads to a lot of problem. So COPD is a preventable, treatable, manageable and curable disease. So we have to find out early, needs a lot of awareness. So short of breath, think COPD. With that, I conclude my talk. Thank you very much.